When creating the sterile field, there is more than one way to do it. As long as you maintain the sterility and avoid contamination, maintaining the 1-inch sterile border, even in the overlap of materials, and keeping it close to,
under overlap.
Okay.
Start from there.
Even with the overlap of materials, maintaining that 1-inch sterile border and keeping it close to the patient, you will avoid contamination. In this second portion, we're going to go through the cleaning and insertion of a Foley catheter in a male patient. My setup is the same as with the female patient, including the sterility of the field that I'm working in. I have prepared the materials by opening the betadine and putting it onto the cotton balls. I've also opened and placed my lubricant into the tray, and I have prepared my Foley catheter by putting the syringe on. At this point, I'm going to remove the bag, leave the catheter coiled in, take the bag and drop it next to onto my sterile field, and then I'm going to proceed with cleaning for the male patient. Same principle applies with the female patient with your left hand. You will anchor your hand at the base of the genitalia, holding it firmly, grabbing the forceps and a cotton ball soaked in betadine. You will start at the outermost portion, cleaning in a circular motion down and around to your hand. Dropping that cotton ball, and you will use all of the cotton balls that are provided in the kit. Same circular motion, covering other area until you have used all of the cotton balls. And I'm going to drop the cotton ball and the forceps together into the bag. Taking my catheter, again, I want to have maximum control on the material. So I'm going to lubricate the first 1 to 2 inches, making sure that I'm holding it firmly as I go to insert. And again, at this point, you can instruct the patient to take a deep breath in, begin to insert the catheter, and have them exhale. And that may help them relax a little during the process. The male insertion is similar to the female insertion, that you will go until you see the flow of urine and then go 1 to 2 inches past that. The reason that we go 1 to 2 inches past that is so that the balloon of the Foley catheter, which secures the catheter in the bladder, is floating within the bladder and not stuck in the urinary meatus. So I see the flow of urine. I'm going to inflate the balloon. And I will proceed with securing it to the leg. You want to be sure that there are no kinks in the tubing of the Foley catheter bag. With the patient's leg flat on the bed, I'm going to secure the bag to the bed itself. Once the catheter is inserted, you want to make sure that there are no kinks in the tubing. And there are points on the bed, little hangers on each bed, that you can hang the catheter on so that it does not touch the ground. It is incredibly important that this port does not touch the ground, because that will introduce bacteria into the bag, into the tubing, and potentially into the bladder, causing a urinary tract infection associated to catheter. There are hooks on the bag itself for ease of securing it. And that's how we secure the Foley bag to the bed. There is a clamp on the catheter tubing itself that is helpful in also preventing the tubing from moving around and creating any trauma or discomfort for the patient. This can be clamped to the pad underneath the patient or to the sheet. It's important at this point to teach the patient about the device that you've just inserted in terms of moving around and getting up. You may find that you put a fall risk band on the patient in the beginning of them being with the device so that they know to call for help.